1. Deadly flesh-eating bacteria in Florida. What you need to know about Vibrio vulnificus. 2. Florida's deadly waters. How to catch the flesh-eating bacteria Vibrio. 1. Deadly flesh-eating bacteria in Florida. What you need to know about Vibrio vulnificus. Imagine stepping into the warm, inviting waters of Florida's coastline, only to find yourself at risk of encountering a deadly, flesh-eating bacteria. This might sound like the plot of a horror movie, but unfortunately, it's a harsh reality that has already claimed the lives of 4 people in Florida this year. The culprit behind these tragic deaths is Vibrio vulnificus, a type of bacteria that is commonly found in coastal waters. But here's where it gets alarming: this bacterium can cause severe illness and even death, especially for those with weakened immune systems. As of now, a total of 11 people have contracted the bacteria in 2025, according to the Florida Health Department. So, what exactly is Vibrio vulnificus, and how can you protect yourself from its deadly grasp? To start with, Vibrio vulnificus is part of a larger group of Vibrio bacteria that thrive in warm, brackish seawater. These bacteria can enter the body through open wounds when people are swimming, or by consuming raw shellfish, especially oysters. Although infections are rare, Vibrio vulnificus can cause an illness called vibriosis, which is often marked by vomiting, diarrhea, and abdominal pain, as well as potentially severe skin infections. But this is the part that most people miss. Even if you're healthy, you can still experience mild symptoms, but for those who are immunocompromised or have chronic liver disease, the risks can be fatal. In fact, about half of the bloodstream infections caused by Vibrio vulnificus are deadly. And this is the part that sparks controversy. Some people argue that the risks associated with Vibrio vulnificus are exaggerated, while others claim that the bacteria pose a significant threat to public health. So, what do you think? Do you believe that the risks associated with Vibrio vulnificus are overstated, or do you think that more needs to be done to raise awareness about this deadly bacteria? Let us know in the comments. Now, back to the facts. If Vibrio vulnificus enters the bloodstream, it can cause severe illness marked by fever, chills, septic shock, and blistering skin lesions. In some severe cases, it can even cause an infection called necrotizing fasciitis, which is when the flesh around an open wound dies. This rare side effect has led to Vibrio vulnificus being described as a flesh-eating bacteria. But here's the good news: there have been no reported cases of person-to-person transmission, according to Florida Health. So, how can you diagnose and treat a Vibrio vulnificus infection? The bacterial infection is typically diagnosed by testing cultures obtained from stool, wounds, or blood. For mild infections, the Centers for Disease Control and Prevention, CDC, recommends increasing fluid intake to prevent dehydration. However, for those with severe or prolonged infections, antibiotics are necessary to improve survival rates. In some cases, surgery may be required to remove dead tissue. But prevention is always better than cure, right? So, what can you do to protect yourself from Vibrio vulnificus? For starters, health officials caution against entering warm saltwater or brackish water if you have any fresh cuts, scrapes, or wounds. It's also recommended to avoid consuming raw oysters and other raw shellfish, and to avoid cross-contamination of other foods with raw seafood or its juices. Additionally, wearing protective gloves when handling raw shellfish can significantly reduce the risk of infection. And if you have liver disease, cancer, diabetes, HIV, or thalassemia, you should take extra precautions, as you are at a higher risk of complications. In 2024, a total of 82 cases of Vibrio vulnificus and 19 deaths were reported to Florida Health, while in 2023, there were 46 cases and 11 deaths. As we move forward, it's essential to stay informed and take the necessary precautions to protect ourselves from this deadly bacteria. So, stay safe, and stay aware. And remember, Your thoughts and opinions matter. Do you think that Vibrio vulnificus poses a significant threat to public health, or do you believe that the risks are overstated? Let's start a conversation in the comments below. 2. Florida's deadly waters. How to catch the flesh-eating bacteria Vibrio. Imagine swimming in the warm, inviting waters of Florida, only to discover later that lurking beneath the surface are bacteria so dangerous they can eat away at human flesh. It's a chilling thought, isn't it? While these Vibrio vulnificus infections may be rare, their potential for devastation is very real. And here's where things get even more concerning. Despite a recent decline in cases, experts warn that the risks remain as menacing as ever. So, what does this mean for residents and visitors alike? Let's dive deeper into the story. In 2025 alone, 4 lives have already been tragically claimed by Vibrio vulnificus in Florida, one of those occurring right in South Florida. These fatalities are part of a total of 11 confirmed cases reported across multiple counties this year. This marks a notable decrease compared to last year when infections surged dramatically, with 82 documented cases and 19 deaths attributed to the same pathogen. Health officials believe Hurricane Helene played a significant role in fueling that spike back in 2024. But don't let the lower numbers fool you, the threat hasn't vanished. Since 2016, Florida has seen an alarming 448 cases and 100 deaths linked to Vibrio vulnificus. In 2025 specifically, fatalities have occurred in Bay, Broward, Hillsborough, and St. Johns counties. Other areas like Duval, Escambia, Lee, Manatee, Santa Rosa, and Walton counties aren't off the hook either, reporting additional non-fatal cases. Notably, St. Johns County has had more than one case this year, underscoring how widespread the issue can become. But just how common, or uncommon, is this terrifying bacterium? According to the Centers for Disease Control and Prevention, CDC, while Vibrio vulnificus infections remain relatively rare on a national scale, they pack a punch when they do strike. The CDC estimates approximately 80,000 Vibrio-related illnesses and around 100 associated deaths occur annually in the United States. For individuals with weakened immune systems or chronic health conditions, the stakes are significantly higher. Dr. Edward Hirsch, an infectious disease specialist at HCA Florida University Hospital, explains why certain groups need to exercise extra caution. Those most vulnerable include people who are immunocompromised, such as those with cirrhosis, undergoing chemotherapy, or anyone dealing with any form of compromised immunity, he says. He goes on to describe the symptoms, which range from blisters and swelling to nausea, vomiting, diarrhea, fever, and chills. Left untreated, the infection can progress to destroy tissue wherever it takes hold in the body. It essentially creates a hole in whatever area becomes infected, Dr. Hirsch warns. Preventing exposure is key to staying safe. Dr. Hirsch advises rinsing off thoroughly after swimming in ocean water and ensuring all seafood is cooked properly before consumption. Though it's extremely frightening, it's also exceedingly rare, he reassures. However, prevention isn't always straightforward. When CBS News Miami reached out to the Florida Department of Health in Broward County to clarify whether transmission occurs primarily through contaminated food or direct contact with water, no response was provided. So, how exactly does someone contract this dangerous bacterium? Here's what we know. Consuming raw or undercooked shellfish, particularly oysters, poses a major risk. Open wounds exposed to warm saltwater or brackish environments can also serve as entry points. There's currently no evidence suggesting person-to-person transmission. Diagnosing Vibrio vulnificus requires vigilance. Physicians typically rely on stool samples, wound cultures, or blood tests to identify the bacterium. Labs must be alerted beforehand to use the appropriate growth medium. Moreover, Doctors should consider Vibrio as a possible culprit if patients present gastrointestinal issues or wound infections following seafood ingestion or seawater exposure. The symptoms vary depending on the type of infection. Gastrointestinal illness manifests as watery diarrhea, vomiting, and abdominal pain. Wound infections can escalate quickly, leading to ulcers, tissue damage, and sometimes even amputation in severe scenarios. Bloodstream infections, though less frequent, carry a high mortality rate. Symptoms include fever, chills, low blood pressure, and blister-like skin lesions. For those wondering how to minimize their chances of encountering Vibrio vulnificus, there are practical steps you can take. Steer clear of raw oysters and shellfish whenever possible. Cooking seafood thoroughly is essential. Avoid cross-contaminating raw and cooked foods during preparation. Keep open cuts or abrasions away from warm saltwater or brackish water sources. Wear gloves when handling raw shellfish or seafood. Refrigerate leftovers promptly to prevent spoilage. If an infection does occur, swift action is critical. Antibiotics are usually administered immediately, and proper wound care is vital. In extreme situations, surgical intervention, including amputation, may be necessary to halt the spread of the bacteria. And now for the million-dollar question: is enough being done to educate the public about this hidden danger? Or could more aggressive measures help curb future outbreaks? We'd love to hear your thoughts. Do you think awareness campaigns should ramp up, or are current efforts sufficient? Share your opinions in the comments below.